Have you ever noticed that no matter how much you diet or exercise, your legs just don't slim down? That your lower body is disproportionately larger than your upper body and it's painful? You might be one of millions of women suffering from a condition called lipedema, often referred to as the painful fat disease. And shockingly, most women who have it don't even know it. Today, we're breaking down the top 7 physical signs that could tip you off to the fact that you may be dealing with lipedema, plus what you can do about it. Let's dive right into it. Number 1, you may have a disproportionate fat accumulation in the lower body. This is one hallmark sign of lipedema, and it's a striking imbalance in the body proportions. You may have a slimmer upper body, like a normal sized waist or torso, while hips, thighs, and buttocks appear significantly larger. This can lead to what's called a pear-shaped appearance that doesn't respond to typical weight loss strategies and exercise. The number 2 sign is what we call cuffing at the ankles and at the wrists. It's a classic visual cue where fat deposits are abruptly stopped right above the foot and the hand, creating what we call a cuff or a bracelet effect. It looks as if the fat is spilling over an invisible elastic band. And again, the feet and hands are typically spared, and this helps us differentiate lipedema from other causes of leg swelling like lymphedema. Number 3 sign is lobules of fat, especially around the knees and hips. You may notice bulbous, lobulated pockets of fat, often described as lumps or nodules, particularly around the inner knees, outer thighs, and the saddlebag area. These lobules can make the legs appear bumpy or irregular and not smooth like typical fat distribution. Number 4 sign is tenderness and pain in the fatty tissues, unlike regular body fat. The fat in lipedema is often painful to the touch. There may be burning, aching, or even throbbing discomfort in the affected areas, especially after prolonged standing, walking, or sitting. Many women describe a heavy or dragging sensation in the legs, even though their circulation and their laboratory results may appear perfectly normal. Number 5 sign is easy bruising and fragile capillaries. Lipedema fat is highly vascularized, which means it has lots and lots of blood vessels in it, and these blood vessels are very fragile. This leads to easy bruising, often without any clear injury or memory of how the bruise was caused. So if you find mysterious bruises appearing on your legs or arms regularly, this could be a major red flag. Number 6 is a family history of a similar body type or symptoms of lipedema, which often runs in families. You may notice that your mother, sisters, or aunts have a similar body shape to you, or that they share some of the same struggles with a disproportionate fat distribution or the pain and bruising that you're experiencing. This genetic connection is definitely powerful. So if you've seen this pattern in your family, don't ignore it. Number 7 will be lumpy nodular texture to the fat itself. When you press on the fatty tissue, it may feel like frozen peas or rubbery nodules under the skin. That's because lipedema fat isn't just soft or squishy. It has a distinct texture that often worsens over time if not addressed. Now let's talk about how lipedema progresses. There are 5 recognized types of lipedema. Type 1 is where the fat deposits are isolated to the hips and buttocks. Type 2, the fat extends down to the knee area. In type 3, the fat extends all the way down to the ankles from the hip and buttocks, but still the feet are spared. In type 4, the arms are involved, especially the upper arm or the brachial area. And in type 5, which is a rarer variant, which I have rarely seen, is where the fat is isolated just from the knee down and the other areas of the body are unaffected. So why does the diagnosis matter? Because with early intervention, you can potentially slow progression, reduce pain, and improve your quality of life. There are many treatment options, including manual lymphatic drainage, compression garments, exercise and movement therapy, nutritional support, and in select cases, liposuction by a trained specialist in lipedema care. One of the promising areas of support is micronized purified flavonoid fraction, or MPFF. This is a supplement made from citrus-derived flavonoids like diosmin and hesperidin, and in some people it may help to reduce swelling, pain, and tissue tenderness associated with lipedema and lymphedema. If this sounds like you, be your own advocate. Most primary care doctors and even many specialists are still unfamiliar with lipedema. It's often misdiagnosed, and it's thought to be simple obesity or just dismissed entirely. So I urge you to do your research, look for a physician or clinician that specializes in lipedema diagnosis and care, and don't stop looking until you find the right answers. If this video helped you better understand your body, please comment and subscribe to the channel. We talk about circulation, lymphatics, venous health, and whole body wellness every week. If you have questions about lipedema or want to share your story, I'd love to hear from you in the comments. Take good care of yourself, and remember, real answers lead to real relief. If you're interested in learning more about lymphedema, check out my other video right over here. Thank you.